I'd like to especially welcome all of us who have joined us for the launching of the Accelerating the Scale of Maternal, Infant and Young Child Nutrition Project implemented by FHI 360 Alive and Thrive. I'd like to especially welcome the Honorable Minister of State for Health, Honorable Joseph N. Ekumakama, represented by Dr. Salma Anas Ibrahim, Director of Family Health, Federal Ministry of Health. Please, may we put our hands together as I invite now for his welcome address, ladies and gentlemen, Dr. Obodo, the Project Director, Alive and Thrive, Nigeria.
Distinguished partners present, media, ladies and gentlemen, I'm highly delighted to welcome you all to the launch of Alive and FHI 360 Alive and Thrive, Accelerating the Scale of Maternal, Infant and Young Child Nutrition Project. This project is a continued investment of the Bill and Melinda Gates Foundation in Nigeria. It builds on the successes and learning realized during the Alive and Thrive first 5 years in Nigeria and provides an excellent opportunity to do what we know how to do, save lives of mothers and children. On this new award, Alive and Thrive is working to build capacity of community-based organizations, strengthen primary health care platform for efficient and integrated delivery of maternal and infant young child nutrition services. Thus, we are working with government, community-based organizations, and other nutrition partners to ensure that the response and the goal for the intervention is achieved. The aim is to drive demand for the increased access to high-quality maternal and child nutrition services in our states, which includes Kaduna, Kano, Sokoto, Borno, Bauchi, Yobe, and Lagos states, as well as at the national level. In addition to scaling up proven nutrition interventions, Alive and Thrive will increase awareness of best nutrition practices for mothers and children through mass media campaigns, social media engagements, and community mobilization. Further, Alive and Thrive will strengthen government and local partners' ability to use routine nutrition data for decision-making and performance management at national and at the state levels. We expect that our collective efforts will contribute to Nigeria's attainment of the 2025 World Health Assembly targets for nutrition and rule the SDGs. The Alive and Thrive team appreciates immensely the leadership of the Federal Ministry of Health and the Federal Ministry of Finance, Budget and National Planning over the years. We are also grateful for the warm welcome that and support that we received from the government of the 7 states. We also appreciate the goodwill and collaboration that we receive from partners through the years. And we look forward to working with all stakeholders to advance maternal, infant, and young child nutrition agenda in support of Nigerian mothers, babies, and their families. Finally, I would like to express the profound gratitude of the Alive and Thrive team to the Bill and Melinda Gates Foundation for this opportunity. We appreciate your support and confidence in us to partner as a partner of choice for the Gates Flagship Nutrition Project. We are also thankful for your immense support to the government of Nigeria and a host of other partners that are working to improve the country's nutrition landscape. I thank you once again for coming, and thank you for listening.
Ladies and gentlemen, please one more time, let's give it up for Dr. Victor Obodo, recognizing the importance of maternal nutrition for better health outcomes for women and children. Alive and Thrive is unveiling this project today, and he's also reiterated the importance of having their partners believe in their ability to deliver. Thank you again, Dr. Obodo.
Standing on the existing protocol already established, on behalf of the Director, Social Development, and the Head of Nutrition, Mrs. Chito Nelson, we welcome you all to this wonderful day. A day like this, we are here to provide solution to the children of Nigeria. The Ministry of Finance, Budget and National Planning on its capacity were established for ensuring the coordination of food and nutrition activities in the country. It has an open door policy for all development partners relating with government of Nigeria, ensuring that interventions are well carried out in the country. We will keep on playing enabling environment. At the state level, we interact. Like the 7th state, we urge you to key into the process. Because of the limited resources in the country, we so much achieve more when we work collaboratively with development partners. With their resources, joining with the one of the federal government to carry on nutrition activities, we will notice that if we work as a team, as a multi-sectoral team, we achieve more results. I here to let you know that the ministry, under the capacity of the head of nutrition, that the environment is already conducive for every development partner to drive well. And I assure you that we have an open door policy that anytime you come around, we'll be able to interact and provide solutions so that we can be able to better the life of Nigerian children as a whole. I welcome you all. We look forward for a fruitful deliberation and this program to come to stay in your state. If program is coming to a state, from the very first day the program is being established, they have to be modality for sustainability plan. And the state should look into key area where this program will be sustained at all levels so that even those at the rural level can be able to achieve results. Thank you, and I wish you a fruitful deliberation.
Thank you very much. Very clearly, he's again said that it's important that as we're planning these programs, as we're implementing these projects, we must have sustainability plan. Thank you very much for that.
Thank you. Good morning, everyone. Honorable Minister of Health and distinguished guests, allow me to stand on existing protocols. On behalf of the Mission Director, Dr. Ann Patterson, and the American people of the United States of America for International Development, USAID, would like to thank you for inviting us to this important event. We congratulate the government of Nigeria and Bill and Melinda Gates Foundation and stakeholders on this important launch of the Alive and Thrive, Accelerating the Scale of Maternal, Infant, and Young Children project. Nutrition is a key development initiative at USAID and considered a priority issue by the Mission Director. Moreover, this year, Nigeria was actually selected on a global level by USAID as a priority, nutrition priority country. And what that means is we've got a little bit more attention, focus, and hopefully resources that can be directed at nutrition in Nigeria. Through our multi-sectoral approach, USAID's committing to bringing life-saving interventions and commodities to the mothers and children affected by malnutrition in Nigeria, in partnership with the government of Nigeria and many of the stakeholders in this room. At the core of USAID Mission Nigeria's multi-sectoral nutrition strategy is a planned approach and robust investment in mothers, infants, and young children's nutrition, also known as MYCIN. Our strategy emphasizes efforts in the first 1,000 days of life, bridging nutrition during pregnancy and through the postpartum period. Together, multiple stakeholders and partners can help our ambitious goals become a reality for a more healthy, productive, and resilient Nigeria, especially for those most vulnerable and for the children. This goal strategically aligns with the Nigerian government's priorities and the objectives of partners, including Alive and Thrive. Our collective support at the national and subnational levels will advance progress towards the 2025 World Health Assembly nutrition targets. For over 20 years, USAID has been a proud leading champion of MYCIN. As it relates to today's event, our progress includes working with Nigerian government and implementing partners to expand access to feeding, counseling infants and young children in Nigeria. Close to 10 years ago, we were able to have the counseling tools and resources translated into 6 local languages to expand the reach of these critical materials. In addition to counseling, we've been proud to support policies, guidelines, and programs across supported states. Most recently, and I think that a few of you in the room probably met the USAID Chief Nutritionist, Sean Baker, who came to Nigeria, and he helped to launch, unveil, actually, let me just give you a few quotes from Sean before I jump over that part. When Sean was here, he talked about Nigeria, the giant of Africa, is already a powerhouse of talent and innovation. He went on to say, imagine what a powerhouse this nation will be when it's freed from the burden of malnutrition. He was here to help launch and disseminate the nutrition policy, strategy, and guidelines. Today, USAID reaffirms our commitment to sustain engagement in MYCIN and our robust collaboration with Alive and Thrive through the Acceleration Scale of Maternal, Infant, and Young Children Nutrition Project. We're delighted to be part of this great event, and we wish you a successful launch. Thank you.
Thank you. I think a big quote has come out of that one. Imagine how great Nigeria would be if they can address the issue of malnutrition. Thank you very much, USAID.
Let me start from the building point, which we just saw, which is the proof of concept that Alive and Thrive actually started with, or the FHI Alive and Thrive 360 project started. If we take ourselves back to memory lane, my discussion quickly will take us to give us the background, which is a very brief background of how it all started in Nigeria, but learning from what happened in other parts of the globe. And then, of course, we've already seen nips of what has happened in the past 5 years. And then, again, my colleague will join me to take us through what we are committed to do in the next 5 years in the country. Next. Of course, everyone here, whether in the name of Alive and Thrive or partners and donors, to support the government of Nigeria to, of course, maximize life, improve quality of life, and then strive, as we say in Alive and Thrive. Building on the proof of concept, some years back, Alive and Thrive tested that concept in other parts of the globe, some countries in Africa and Asia, using a tested model, which proved that with well-established, well-designed program, actually norms can be shifted in terms of behavior, can improve the quality of life, increase positive behavior among caregivers. That ran through the period, and then the same model was adopted and imported to see that it can be expanded into other parts of the globe. 2016, Nigeria adopted the model to support the government of Nigeria and implement the IYCF project. The project ran for 5 years, fully funded and supported by Bill and Melinda Gates Foundation and other partners. The essence was, again, to institutionalize the commitment of maximizing life and improving the quality of life. In 2016, the project committed to support the government at the national level, at the policy level, and also work with the states and of course communities at the grassroots level, where it applied the adopted model that has already been tested globally and proved to be very successful in shifting norms and improving the quality of life. The model is simple. Issues that relate to policy, address them by involving partners across the globe within the country. It also looked at IPC to improve the quality of interaction between caregivers, and community mobilization to ensure grassroots involvement, and of course, mass media communication to increase awareness and knowledge based on the evidence of data to see that sustainability is also actualized at the end. That was the fulcrum of the strategy that Alive and Thrive tested globally and adopted, applied in Nigeria. Before getting into that, there were a key question, just like in any project. A&T engaged an RTI, an research agency called RTI, to support the development and the provision of the baseline information of the situation where we came in 2016. Issues around policy, issues around service delivery, issues around community involvement and participation. At policy level, there was a need, and the key issues that was concerned was the resource allocation. This has been said over and over, but there was the concern to see that that should be one of the focus of the project. There was also issues to do with attention, and the policy attention in terms of commitment, both at the national and state level. And there was also the need to provide critical concern around knowledge and information. Whereas at the service delivery, the primary concern was the quality of service based on the skill of the providers in terms of interpersonal communication between the provider and the beneficiaries of the service. This also, of course, related and reflected around the level of community involvement, community participation, culture, and norms that were surrounding the behavior of infant feeding practices within the country. These were the challenges that were found when Alive and Thrive came in 2016. So it focused on several states, starting with 2, Kaduna and Lagos, and scale up to 9 more states to make 11 states. The focus remained consistent to address 4 fundamental elements: improve policy, quality in terms of government involvement, funding, and address critical policy issues in child feeding practices, improve community interaction, improve data quality and use of data, and of course create massive critical mass awareness and knowledge around the issues. This resulted to several issues, which we like to simply assume they could have been summarized into 3 or 4. But fundamentally, Alive and Thrive committed and supported the government of Nigeria to improve critical advocacy and policy issues, which revolve around supporting breastfeeding at workplaces and then BMS code. At the service delivery, it also provided support to improve the quality of skill of the provider by improving the training manuals, making it friendly, and simplifying the time to engage with service provider and provide the knowledge required in terms of service delivery. Whereas at the community level, it improved the level of communication, creating critical mass awareness, improving knowledge through various formats and platforms of communication and others. Some impressive results came. Some were expected, and some were naturally assumed that with such massive intervention of strategy, some little results will come in. I would like to share with you a sample from the 2 states that were the focal state at that level. Now, when we look at the baseline, where we came in, and then the intervention, we see that exclusive breastfeeding during the period of intervention, the result showed some significant increase in terms of the behaviors related to exclusive breastfeeding, which we would like to claim resulted through the interventions that was provided. For example, at the interventions of 23% baseline, it increased to almost about 40-45%. And the same thing happened also in Lagos with some significant increase, even though not impactful as it was done in Kaduna State. Behaviorally, in terms of communication, mothers' exposure to messages was very significant because IPC was a fulcrum based on the fact that service providers' skill was improved in terms of interpersonal communication. At the community level, critical community stakeholders' communication also improved, and then with the mass media. So we saw that within the context in Kaduna, there was some increase, especially that came through the radio, TV spots, comparatively from using the intervention and the comparative level of the program within the period we're talking about. Rising, for example, in television, significant number of those that had access information during the intervention and from what we found. Next, also in Lagos, even though we didn't see much significance in terms of television, but because Lagos is a media state, over 150 radio stations, bulk television, the competition was significant there, yet we're able to see that significant population of the caregivers were reached through television. But then we see that the impressive result was through the print media, which were available in facilities at the community levels, and like you saw, through bus branding and so on and so forth. The same household survey results show that at the end, comparatively between the two locations, starting from the baseline to the end line, we could actually summarize and recognize some significant improvement. Kaduna, for example, in the early initiation of breastfeeding, increased from 40% to 46%. And then in Lagos, there was some not significant increase compared to that. However, looking at exclusive breastfeeding in Kaduna, we could see significant increase. And even in Lagos, there was, now, bearing in mind that we're comparing two fundamentally complex locations, extremely cosmopolitan urban Lagos, and also a city that had a mix of urban, rural Kaduna, we could see that there was a blend of such changes as it was the case may be. This was the situation when we came in, and then that also necessitated to see, can we improve on that? Can we go beyond only IYCF into maternal and child survival? Thank you.
So, against the backdrop of the previous interventions in the 11 states that AK has so beautifully spoken about, the current grant was awarded November of last year and is expected to run through 2026. Now, what is the key difference between this grant and the previous? So while the previous grant was focused on infant and young child feeding, this grant would be expanded to include maternal nutrition. Additionally, we'll be looking to partner with government to build local capacity of indigenous community-based organizations to implement and sustain this intervention in the communities and at the health facility level.
I want to please beg to stand on the existing protocol. Thank you. My name is Ifedeli Chukwuekene Innocent, and I'm standing here as the chairman, Civil Society Scaling Up of Nutrition, the steering committee arm. Today we are happy to be part of what is going on, because Civil Society Scaling Up Nutrition, CSON, believe that whatever that has worked elsewhere should be scaled up. We believe in learning and sharing.
We believe in promoting strategies, interventions that has worked. And so we're happy to be part of this launch of the project. Again, our major interest has to do with maternal, child, and infant health. And so we are here this morning. We are here this morning to celebrate and align with Alive and Thrive and other stakeholders that are here because all the efforts that are geared towards creating an enabling environment for scaling up maternal, infant, and young child interventions, especially at community level, is what we also promote. I have talked about learning and sharing. It is critical at this point for us to continue to share and learn strategies and promote what has worked elsewhere and all that. We work in most of the states that are where you will be implementing this intervention. We work in Kaduna, we work in Kano, we work in Bauchi, we work in Yobe and Lagos. Just to add that we will continue to collaborate with you. We'll continue to work with you in different angles to ensure that issues that have to do with nutrition is promoted at different levels. And most importantly, join resources together, put our efforts together to be able to meet the needs of women and children, especially those that are living in poor and those are living in poor and hard to reach communities. Thank you. I wish us a fruitful celebration.
Permit me to stand on the existing protocol. I'm here to say on behalf of all the honorable commissioners and the executive secretaries here present, I'm not too sure this fits me very well. However, I'm taking a post-fact consent. I've not consulted with all of them, but I'm sure I can speak on their behalf. And I wish to appreciate our invitation here to the launch of the Accelerating the Scale of Maternal, Infant, and Young Child Nutrition launch here in Abuja. And we, the representatives of the 7 states, we feel this launch comes at the right time. If we look at the pamphlets that are given to us in all the 7 states, maternal anemia is high, with the exception of Lagos. We all have more than half of the pregnant women in all the 7 states anemic. And also, if you look at the practice of exclusive breastfeeding, it was also not very high, and so on and so forth. And over the last 2-3 years, all state governments I know of Kano, precisely where I am, and also in Kaduna, in Yobe, in Sokoto, and in all the 7 states, there has been a concerted effort to improve maternal and child nutrition. Therefore, a launch of this project comes at the right time that we are making this concerted effort. Therefore, it will complement what the states do. And if again we look at the presentation, we've seen that this project comes to support us to improve our system. Not only nutrition, but is improving the entirety of the system. Therefore, we stand to benefit most out of it. Therefore, we are grateful for choosing our states to be part of this project. And Because of the immense benefit this project is bringing to our states, I, on behalf of the honorable commissioners here present or their representatives, on behalf of the executive secretaries of the 7 states here present, I wish to express our commitment, and we will provide all the needed support to ensure that this project succeeds, and I know it will succeed. The last presenter asked, there were 4 key asks. If you can, this previous slide. Yes, this one. The presenter asked the honorable commissioners and the executive secretaries these 4 key asks. I'm sure I'm speaking on behalf of Kano, which I'm representing the honorable commissioner. I'm speaking on behalf of Kaduna. The executive secretary is here. I'm speaking on behalf of Lagos, on behalf of Yobe, on behalf of Sokoto, on behalf of Borno, on behalf of Bauchi, that these 4 key acts are granted. Consider them done. We will see how within our states we fulfill these key acts. And on behalf of the 7 states, I wish us happy lunch. Thank you.
When you hear a government official say to you that you can consider these requests done, it doesn't come every day. Thank you for your commitment. Thank you to all the commissioners from the various states. Thank you to the government of Nigeria. Ladies and gentlemen, at this point, I'll now be inviting for a 2-pronged activity. First off, a keynote address that would lead up to the official launching of the Accelerating the Scale of Mycin Interventions in Nigeria project. Minister of State for Health, Honorable Joseph N. Ekumankama, represented, ladies and gentlemen, by Dr. Salma Anas Ibrahim, Director of Family Health, Federal Ministry of Health. You're welcome.
Let me start by acknowledging the Federal Ministry of Health team, led by Dr. Binyerem Ukai, our friends also from the Federal Ministry of Budget Planning. The Island Federal Ministry of Women Affairs is also here. We also have high-level representation from the Nigerian Governors Forum. You're all welcome. I also want to acknowledge the representative of USAID, BMGF, even though we learned they are still sleeping. But I'm sure he'll be dreaming of us here, that we are acknowledging them. UNICEF, the World Bank Group, civil society organizations, all the implementing partners that are here with us this morning, the country director, FHI 360, and all the team from FHI. FHI is a home to me. So I also have to acknowledge, most importantly, in all this gathering, the representation from the state. They are the key people, because they will make it happen, and they can decide not to make it happen. So I really appreciate your coming here, and I'm happy that all the commissioners are fully represented by the state primary health agencies. And I wonder why we don't have MPHCDA here, because it's a key partner. So I welcome you, all of you from the 6 states plus Lagos 7. I said plus Lagos 7. Lagos is an exception, isn't it? Eko? How do you say it in Lagos? So these states have been carefully selected, and they've also added on Lagos on it to share practices. We have Kaduna, we have high burden states like Sokoto, Jigawa, Kano, and I'm glad we've also gone far to the northeastern part of Borno, And the northeastern part, Borno, Yobe, and we have Bauchi. These are the high burden states for malnutrition. And there are lots of lessons to learn, and I'm happy with the continuation in Kaduna and in Lagos so that we can learn lots. So you are most welcome to the city of Abuja and to the best hotel in town, Hilton. You are doing well, FHI. So I'm here to represent the Honorable Minister of State for Health. The minister actually wanted to come himself, but they are having a retreat, which you have all seen on the national television. They started yesterday, and it's continuing today. So he has asked me to represent him and also send all the greetings to you. So he has a written speech, which I will try to look at it. He said, I'm glad to be with you at this very important launch of accelerating the scale-up of maternal, infant, and young child nutrition project. The minister is actually very passionate about nutrition. His first outing when he became minister a few months ago was on breastfeeding, when we launched the breastfeeding day. So he really wanted to be here with us. So he is very happy to be in this gathering. The provision of adequate nutrition during infancy and early childhood is a basic requirement for the development and promotion of optimum growth and health of the child. It is well-established fact that malnutrition interventions play an important, maternal nutrition and child nutrition plays an important role in improving the health of mothers and their children. We always talk about the 1,000 days. And someone asked me, what is special about the 1,000 days? And I say it is a critical time in the lifetime of every individual. And that is the time when the brain develops. And it matters what you feed the child with, because that is the critical moment for our children. So I'm happy we are doing this again for our mothers and the children. The Federal Ministry of Health recognizes that inadequate nutrition has far-reaching implications for the children and the nation at large, which include developmental delays, impaired educational ability, a lifetime of poor health, increased risk of diseases, especially chronic diseases, and generally decline in human capital development. And you can all know that in Nigeria, we are still struggling. We don't have to go to the statistics, but Dr. Binyarem has summarized a very beautiful statistics here, which is the latest that came out from the survey that is currently going on, supported by the ARIN, Acceleration of Reduction of Nutrition in Nigeria. So they've launched the preliminary findings, and we are still not yet there. And we've also seen the mixed survey, the findings, which has also shown very little progress. We've seen progress more in immunization coverage, but all other aspects. We've also seen progress in family planning, which is very much associated also with child survival and nutrition of children. But other aspects of nutrition, we are still lagging behind. The progress has been very slow, but I believe that now we have the road, we have defined the road, and we are on the road to success by the grace of God. I would like to commend Alive and Thrive for this project, which is coming, as my previous speaker has said, from Kano State, Dr. Tijani. And I keep on saying, we keep on swinging from the agency to the ministry. So I'm happy that it's happening. It's additional value to our work. Now that you are in the agency, you will appreciate it very well. And now you are driving it very well. So, and this was what I told my colleague also from Borno. Now he's back to the Ministry of Health. And the person on that seat is back to the agency. And I think it's a good swapping, yes, for Nigeria to progress. So just like what you said, that we still have a lot to do. We are not yet there. We need to double our efforts to ensure that we really put in enough time, enough resources. Most importantly, to acknowledge that there's a problem. I think that is still lagging by especially most of our leaders, to acknowledge that there's a problem. As I said, what we give the children really matters, and what the mothers eat also at that time, it really matters. I believe that this project will not only accelerate maternal, infant, and young children feeding, interventions. But it will greatly impact the nutrition narrative in the country by directly addressing nutrition issues affecting mothers and children right at the grassroots level. So the minister is saying here that he's very glad that the project will continue the enabling environment, providing enabling environment and technical support for the state. But at this junction, I just want to remind us that if you recall some few weeks ago, the Honorable Minister of Health himself launched some policy documents. And this is very important in creating the enabling environment. He launched a policy document, a strategic documents, guidelines, including the baby-friendly initiative, which was also supported by FHI 360. So these documents are not meant to be on the shelf. They are meant to create that enabling environment. So when we go back to our state, and I'm happy when Stephanie made the presentation with Kawu, they talked about policy issues. There is need at the state level to adapt and operationalize these policies and make them work. So FHI 360, as part of Alive and Thrive, will also support to operationalize and institutionalize those policies at the state level. So as I said, is that we have to start the ownership, the institutionalization, not only at the end of the project, or in 2022-25, when the project is about to end. The sustainability starts today, because it starts with that ownership. So not bosses, I don't want to use the word bosses, the leadership at the state level must take responsibility fully. I'm glad that space have been created for the team in some selected states to stay with them and work together. And then this will help to fully institutionalize. But I also want to add that last week or 2 weeks ago, I participated online in the FHI meeting where you talk about localization. Localization is very, very important. And we've been talking about the localization. This is part of the localization, and these are part of what does not make sustainability to happen at the end of beautiful project that so much funds have been invested and energy. So we have to ensure that we really localize and ensure that it is fully institutionalized within the states that we are working. Apart from us, government also, the civil society play a very critical role, including the private sector. And we want to see that at the state level also, private sectors are also mobilized, and they also play an important role, because we still recognize that most of our Nigerian populace still seek health services from the private sectors. So we should not leave private sectors alone. And that is why we have abundance of poor quality of services, even within our primary health care facilities. Survey have shown that the National Facilities Survey indicated that we have very poor quality, mainly at the primary health care level and also at the private facility level. So these are areas that we should not neglect when we look into the implementation of the MySIN at the sub-national level. In terms of coordination, I just also want us to look at it again, because I know it's a document that is ready to go, but it's not cast in stone. There is still possibility for flexibility and review to see what has worked and what has not worked. Well, we've done so much in Nigeria, but the main area of challenges are the sustainability aspect. So what is it that we are doing not correct? Because if you look at the structures at the state level, when we started the RAMCA coordination, we realized that there are lots of weaknesses in our coordination systems, not only at the sub-national level, but also at the national level. Because we work more in silos, not only government, but including partners that are supporting. So we want this time to ensure that we have that synergy in terms of more effective coordination and also collaboration and partnership, especially at the sub-national level. The structures that exist, we're talking about policies. Ministry of Health have a big role to play in operationalization of those policies. So you have to have areas of support for ministries of health, and also capacity development, and also tracking of progress, monitoring and evaluation. Then actual implementation also, mainly at the primary health care level. where the operations, the implementations will take place. So there is need to tidy up and link these two together. And also, who also supervises the role of the private sector, implementation at the private facilities. Definitely is not the primary healthcare agency. They are very busy focusing on functions at the PHC level. So when we go to implement, we should take cognizance of all these issues so that by the time we leave this project, we have a dedicated desk officer on nutrition at both Ministry of Health and also at the primary healthcare agency. Because the scope of work is beyond Ministry of Health and is beyond the primary health sector. And a coordination system that will bring everybody together, including the private sector and all the civil society organizations that will be coordinated at the ministry level and also support operationalization and implementation at the subnational level. So this is part of the drive that we are pushing from the national level up to the subnational level. And part of what we've done is to see states also establish those structures. And I'm happy most of the states that are here, we are already working with them in that direction. So having said that, I still go back to the Honorable Minister's speech because they are recording, isn't it? Let me read his speech. So back to his speech, he said that the federal government, of course, is highly committed, to the health and well-being of women, children, adolescents, and even elderly people in Nigeria. But of course, we recognize the magnitude and the burden in mothers and also in children under 5 years. And we are working together to put in sustainability measures in place. And we're going to support you through technical support, creating the enabling environment, and whichever way where you have challenges at the national level. We have the MPHCDA, we have NAFDAC, we also have the National Governors Forum, who are very strong advocates, and they are very good in terms of expertise in creating competition between the governors. And every governor wants to see that his state is on top. So please use all those opportunities. Once again, I want to appreciate Family Health 360 for supporting the government of Nigeria. They've been supporting in different aspects of development. But the work they have done in nutrition in the past few years have really made significant impact, and we have seen it presented this morning. So we look forward to continuous collaboration with you, and we also continue to solicit for additional support, especially now that Nigeria is going through difficulties, economic difficulties. We want to continue to ask for more support from our partners, USAID. Don't relent in your effort to support. You're doing so much, but just like Oliver Twist, unfortunately, this is because of the economic crisis. We still want you, as we continue also to advocate for more domestic financing and support. We also want to ask for more support. We also want to ensure that we are doing so much in terms of localization of content. As you know, that Ministry of Health currently has done so much advocacy and work with manufacturers in Nigeria. And today, the ready-to-use therapeutic food, we have a manufacturing company industry that produces that in Nigeria, including the micronutrient powder. So that is also progress in the midst of all the challenges. And we look forward to your continuous support and collaboration. Thank you so much.
Thank you, Dr. Salma Anas Ibrahim, Director of Family Health, Federal Ministry of Health, ably representing the Honorable Minister of State, Honorable Joseph N. Ekumakama. Ladies and gentlemen, there you have it. Officially, the reason why we've all gathered in here today, the unveiling of the Accelerating the Scale of Mycin Interventions in Nigeria project has been officially declared launched by Dr. Ibrahim. Thank you very much. We will now invite some of our guests to the podium for some pictures, of course, led by Dr. Salma Anas Ibrahim.
I hereby launch the Scale Up project for accelerating the scale up of mycin interventions in Nigeria, in 7 states of the Federation of Nigeria. Thank you so much.